Yes, yes. It's a cold day today. I have so many questions, random questions. I'm gonna answer them right here in the office, right here. Random questions. What time is it right now? 4:30. 4:30 in the evening. Let me find out questions I have that I can answer them. I can answer them so clearly. Yeah, someone is asking me, it's a cold season here in Kenya. Hey, people, Kenya is in Africa. At this time of the month, it's very cold. And someone is asking if cold brings pneumonia. If cold brings pneumonia, what do you think about it? What do you think about that question? If cold brings pneumonia, what is pneumonia? Pneumonia. Pneumonia. Pneumonia is lack of air. Lack of air in your lungs. Lack of air in your lungs, which makes you be sick. Yeah? Which makes you be sick. Yes, yes. Can see Jamaican uncle there. Jamaican uncle, big up. I texted you. I think today it was a busy day. I understand you are here, there, everywhere. Yeah. I'm just answering some random questions here, and I see someone has asked me uh, if cold brings pneumonia. Pneumonia is lack of oxygen. That's a very simple subject. A very simple subject. And if you get into the platform and ask a question, you just ask, I'll answer. It's time for random questions. And we have things that do or that make a person to have chest complications so that you cannot breathe well. Yes, yes. Uh, if your chest is not getting air inside, you will have blockage, and blockage goes and makes oxygen not to be absorbed well in a very layman language. So that is pneumonia. So everything that causes blockage of the airway. Airway starts from the nose, mouth, then to the trachea, to the lungs, to the lungs. Let's see things that can make a person get pneumonia. One thing that cannot make a person get pneumonia is infections. Infections, when you visit somewhere a person has a flu and then you get a flu. You see, when you get a flu, they start you start having colonies of bacteria or virus or fungus in the respiratory system. From the nose airway, they start eating you. And we see when you are being eaten by those fungus, what happens? What happens is, yes, what happens is, yes, Caron White. Caron White, I see you today. Someone asked me if cold brings pneumonia, and I'm answering the person about cold and pneumonia. So I've said I want us to understand what pneumonia is. Pneumonia, I've said, is lack of air, oxygen, enough oxygen. So when you inhale and oxygen is not getting to your system, that is pneumonia. So what can do that? What can do that is, one, you can have an infection. Two, you can have a genetic complication. Genetic complication. Three, you can have blockage from the air system. So we talk about infection first, because many people, when they have flu and they are sneezing, they always say, I'm having a flu. A flu can be viral, a flu can be bacterial, and sometimes when you have pneumonia, it can be fungal. So we have bacterial pneumonia, we have fungal pneumonia, we have viral pneumonia. When you go to near a person who has a flu, and then you get the flu. Most of the virons, the flus that you get are from viruses strains that can make you get pneumonia. When you go close to a person and then you breathe the air that this person is breathing, you will get pneumonia. Why? So these viruses go to your airway. If you went through the videos that we discussed today, we saw things like inflammation. Your airway starts to inflammate because now the virus is working and eating your airway, and then it swells. When it swells, they produce secretions like mucus. Those mucus go to the exchange, the alveoli. I want that person who asked me that question to understand why pneumonia is wide topic. Now, your lungs, let me draw some lungs here, some lungs here, some lungs here like this ones. Lungs look like this, and then they have airway with some bronchioles. So these balls that are inside these balls, these are your lungs. A quick sketch of your lungs. So these balls here, these balls are the ones which exchange air. These ones, they are the ones which exchange air. When you breathe in, you breathe in clean air, oxygen comes out through these balls. So these balls, if they are filled with secretions, if they are filled with the mucus, there will be no enough exchange of oxygen and carbon dioxide which comes out. So you don't have enough oxygen that is going to your system. So this is called pneumonia. Pneumonia. So what differentiates pneumonia from other pneumonias? Now you go to the hospital, a doctor looks at you. This doctor sees, this person is having a lot of sweating. This person, we have to do this test to know if it is bacterial or viral. So if it is bacterial, of course, you will be given antibiotics. But if it is viral, you will be given some relaxers, because viruses, treating viruses, you have to treat with antivirals. But when it comes to flu, at times it's not good to give antibiotics in flus. It's not good. Yes, we can see some cases like Streptococcus pneumoniae. Yes, that is a bacteria. Viruses, influenza, virus, SARS, and fungus. Fungus is a rare thing when it comes to pneumonia, but when you are immunocompromised, your immune system is not functioning well, you can get fungus. Most people who are immunocompromised are people with HIV. HIV, yes, they get a strain called Girovensi pneumoniae. It is common to people who have HIV. So this Girovensi pneumoniae, it goes to the airway, it piles it starts to produce secretions here. When it produces secretions, an immunocompromised person has no good immunity. He gets pneumonia. You see, this is a patient, but still gets pneumonia. Many people who go to hospital, they stay there being treated like an accident, and then you are admitted. You may come out with pneumonia. Why? Because in the hospital, there are some very many strains that are going there. People are very sick. So we call it hospital acquired pneumonia. So I can see Jamaican uncle asking, well, so what can we do when we have that problem. Yes, when you have a flu, it is very important to go to a doctor or explain to a doctor as per the symptoms that you are having. You see, symptoms of bacterial pneumonia are different from symptoms of viral pneumonia and fungal pneumonia. Symptoms, that is very important, of viral pneumonia. Sorry, I'm telling someone something. And viral pneumonia. Now, these symptoms vary. The symptoms vary. A person who has a viral pneumonia, you yourself, you'll be having high fevers with no sweats. High fevers with no sweats. You see? So mostly in influenza virus, respiratory, first you need to know the symptoms, then what you know what to do. General symptoms in flus, you'll get fever, dry cough, shortness of breath because the airway is blocked, fatigue or weakness, chest discomfort or pain in the chest, headache and muscle aches and muscle aches. You see, so what you should do first, you get some drugs that can relieve your airway, some drugs that can remove the secretions. So what you can do is buy something to relax, like salbutamol tablets as you go to the hospital. But you see, symptoms vary because cough can be so severe and until you lose breath. You need to be in the hospital to be checked. Get some syrups. Syrups vary when it comes to pneumonia and chest complication. Chest complications are very wide. You go to the doctor to find out what complication you are having. There are some people who are asthmatic, and there are some people who have COPD, which is called chronic obstructive disorder. COPD, pulmonary disorder. Their pulmonary system is always blocking because of what? Their airway is sensitive. We call it hypersensitivity. So when you inhale even dust, you start coughing because your airway now, the dust is strange thing to the airway. So when it gets to the airway, the cells of the airway tells the body that there is a danger. Please constrict and block so that this thing cannot go down to your system. And you see you are still breathing. So when it constricts, you cough to open up so that to open the airway so that you can get oxygen. So it becomes a continuous process. Constriction and coughing to open, constriction and coughing to open. When you go to the hospital, we give you something called antihistamine. Histamines are like cetirizines. Cetirizines are tablets that these tablets they stop the histamine. Histamine is a chemical which constricts the airway. We have all taken cetirizine at a point, and sometimes we nebulize you so that you can be well. You see, so with these airway problems, people have really misused antibiotics. It is not of importance you take an antibiotic when you are having a viral flu. It's not important. Just take airway relievers. A flu goes for 7 days, takes its course, then you will be okay. Because it's not of importance to treat a bacteria with antiviral. It's not of importance to treat a virus with antibiotics. Yes, you will take the drug, but it will not be helping the problem. When you have a viral flu, just take airway relaxers, some salbutamols, some Pyritons if you are an adult. At times, I don't advocate Pyritons in children. I advocate for cetirizine. It's very important. Yes, yes. If anyone has a question, drop it to my handle. We continue. So we know what pneumonia is. Pneumonia is a problem that is brought by an external thing to your body, like dust in asthma, hypersensitivity in airway is a problem. COPD, chronic obstructive pulmonary disorder, is just hypersensitivity like in asthma. And also in infections, we get something like bacterial pneumonia. And what else? We have said viral pneumonia and fungal pneumonia. Very nice. I know it's a cold season in Kenya right now, and people are confused. So if you get a flu, you say, I have pneumonia. No, a cold does not bring pneumonia. That's no a wrong notion. Cold does not bring pneumonia. When you see you are exposed to cold and you are having chest complications, just know you have hypersensitivity secondary to cold. That is the problem that you are having. Um, we go on. I can see there was a question here by a certain lady about we had talked about it last time, but I see it's still here on my WhatsApp. Someone had asked if if someone gets a baby, being a teenager and you're heading to adulthood, a woman, and someone gets a baby, and will the menstrual periods uh, be less painful? We had talked about it earlier. I think if you go to the other video, you'll find it, but I address it quickly. Like yes, if you get a baby, there are some people who can inherit some problems. So for ladies, if you have a problem in menstruation, in menstrual period, and you are advised to get a baby earlier, take your time because yes, it helps. And the reason why it helps is when you get a baby, yes, just a cough, not pneumonia. When you get a baby, your uterus expands. Your uterus expands, and when it expands, you release less prostaglandins. And we saw what is a prostaglandin. That is a hormone, or Karen White is. And can an asthmatic person get pneumonia easily? Yes, Karen White. An asthmatic person can get asthmatic person can get pneumonia easily in this way. We have seen uh, when someone is asthmatic, this person has hypersensitivity of the airway, and pneumonia is lack of oxygen. So if pneumonia is lack of oxygen, what does it mean? When these airways are blocked, the trachea, from your nose you go down, you have the trachea. You have the trachea. I'll explain how, so that Karen White can understand how. It's very important to understand how you get pneumonia easily. So an asthmatic person, I've drawn this one. An asthmatic person, light, yes, like this. This is the airway from the nose. From the nose, this is the nose, then air goes down. So where you get an asthmatic person has hypersensitivity is here through the trachea. The trachea is the place where you pass air. You pass air here. So when it is hypersensitive, it reacts to histamine. When you get perfumes, you get fur from dogs, pets, and then you inhale. The cells here, they tell your body there is a stranger coming. Now this airway constricts and becomes small. It constricts and becomes small, so air is not getting in to the alveoli Here, we have said the alveoli are small balls, small balls that exchange carbon dioxide and what? And oxygen. So if here is blocked, an asthmatic person is hypersensitive. So if here it is blocked, there will be no exchange of air here. So yes, Karen White, it's very possible a person who is asthmatic can get pneumonia easily, and that's why they are rushed to hospital to be nebulized when you don't have inhalers to open up the airway. They are rushed to hospital, and the airway is being opened up by nebulization. Condition like asthma is a condition that treating it, airway closes from oxygen. Yes, Karen White. Airway closes, so there is no oxygen going down to the lungs. Going down to the lungs. Nice. I see you understand. Now, condition like asthma treatment is not easy. We manage. That's why you will see those people with the inhalers that they work with. We manage them. So if someone tells you I can treat and you'll be better, it's not possible. But if you have a child who has pneumonia, this child will grow and he will overgrow it. So you be patient. Don't give a lot of antibiotics when it comes to asthma, unless the doctor has prescribed. Good. Now, I was talking about the other topic of menstruation. A lady had asked, is it true if I get a baby, the pain that I feel during menses will go away? Yes. That one can happen, and this is why it will happen. You see, when a woman is undergoing menstruation, the pain that comes in during menstruation, it's because of constricting of the uterus. If you go to the other video, I've explained so well, step by step, but here I will rush upon. There are some things that make a woman feel pain when it comes to menstruation, because cramping cramping of the uterus, cramping because of the nerve. You see, there are some hormones or neurotransmitters, hormones called prostaglandins. They are not produced by any gland in your body, but when your cells die because of trauma, they are produced where the cells are. So when the cells that are around the, the, the uterus are dying, because now you want to go for menstruation, we remember the phase we talked about the luteal phase, that phase. When they are dying, what happens? They produce prostaglandins. Now, prostaglandins are mediators of pain. You get it? And they when this flaring off continues, the nerves that are around your uterus, they cause constriction and cramping. So the uterus will start to constrict so that it can push the layer of your uterus out, the layer of your uterus out. When you become pregnant, your uterus enlarges. You get it? When you become pregnant, your uterus enlarges. And when it enlarges, what happens? Now it gets used to, let's say, to stretch. And it gets used to removing little prostaglandins, those hormones that cause pain. So when it gets used to it, after you've given birth, what will happen? Your uterus will be used to be releasing little prostaglandins. And then there is something else. In our previous videos, we had talked about the hormones that your brain front here produce, like serotonin, like the other one which is called dopamine, and there is the other one which is called serotonin, dopamine, and norepinephrine. So when you are in menstruations, women have mood swings, and sometimes they vomit because of one thing. These hormones are down. These hormones are down, like serotonin is called a happy hormone. When it goes down, you don't have moods. Yes, and that's why I talked to women. Please don't judge your women when they are in menses. It is a physiological function. Don't say this woman is always like this. They are our women. Treat them with respect. Pamper them at this time. You will help the serotonin level to go up. So when the serotonin level from the frontal brain goes down, what happens? The mood goes down. Hmm? Prostaglandin levels for pain rises. Yes, yes. Very important. Very important for men who will watch this video, who are here watching. Please don't judge your women when they are in menses. This is a physiological function. So what happens is when serotonin levels, hormones are down, and the norepinephrine are down, cramping becomes more. Cramping becomes more. So how can you help this situation? Yes, painkillers are good to relieve the. We have to reduce the cramping. We have to reduce the nerve sensation inside, and we have to increase the hormones that are reduced because of menses. So which drugs are effective? The drugs that are effective, one, hmm, you can use like fluoxetine, the antidepressants. How antidepressants work is this: they stop the the process of destroying the hormones, the serotonin, the the norepinephrine. You get it, and dopa. Well, they stop the pleasure. You saw these are happy hormones. They make you happy, and you be pleasure. So it stops the breakdown. So these hormones will rise, and then pain in your stomach will reduce. Use some painkillers and like diclofenac, which is an NSAID, and at times you may use antispasmodic because the cramping is spasms. They are spasms. Spasms are stopped by antispasmodics. These are drugs like Buscopan. Drugs like Buscopan. Yes, I think that one I've answered it. And for the people who are undergoing chronic pain, it's important to seek medical advice, but my advice will help more on management. And when you are with the person who is undergoing this problem, uh, as a man, soothe this lady. Yes, very important. Talk to her peacefully. Yes, if she doesn't want to talk, you stay away. Yes, psychotherapy. Yes, she's your woman, she's your sister. Yes, they are our ladies. Yes, we love them. You try and be watchful on how you are handling them between this region. You see, they are very good people. They bring life to this earth. Yes, let's go to other questions that we are handling. Other questions. Other questions. Yes, someone is asking me a question about diabetes. Diabetes. We all have people that are. These are topics that we look at. They are scheduled, and I'll talk about them. But I'll rush. It's just a one-on-one question. Someone has asked through my WhatsApp about diabetes, and the question goes: is there a drug that we can use? Is there a drug? Uh, Let me. Is there a drug that we can use to treat diabetes? Because I've seen a man, but he's not a general practitioner. He's a herbal person who says he has drugs that can heal diabetes. Guys, what do you think? Is there a drug that can treat diabetes? That's a very nice question. Yes, very nice question. Question about diabetes. In diabetes, what is diabetes? Diabetes is a problem that is there when it is, you cannot break down glucose in your body to be stored in your liver. You understand? About diabetes, I'm answering this question, which asks me, is there a drug that we can use? Yes, Evelyn Minage. Yes, Evelyn Minage, I see you. Thank you very much, Evelyn. There is someone who has asked me a question about diabetes. And if you have a question, just ask. It's a random question today. Someone has asked me if there is a drug that can treat diabetes because someone told her they can treat diabetes. And I'm answering by saying diabetes is a disability to break down glucose that you have in your body to another thing called glycogen to go and be stored in your body. You see? So, what breaks down the glucose in your body to glycogen to be stored in your body? Yes. What breaks down that? We have some cells called islets of Langerhans. What are these cells? The beta cells. We have endocrines in the pancreas. You see, alpha cells, we have beta cells, we have delta cells, we have all those. Now, alpha cells, hormone produced is called glucagon. Raises blood glucose by stimulating the liver to break down glycogen to glucose. You get it? And then we have beta cells. These beta cells, they produce insulin, lowers blood glucose by helping cells absorb the glucose. So what are we talking about? We are talking about this. If you don't have beta cells, you will not be able to break down glucose to glycogen. You see, this is what we talk about diabetes. If you don't have in beta cells which produce insulin, and that's why you will hear people saying someone has type 1 diabetes, someone has type 2 diabetes. What is type 1 diabetes? Type 1 diabetes is that diabetes that you are born with. This one is a diabetes that maybe you are born without the beta cells that produce insulin. You see, you were born without them. So you cannot produce insulin when you eat and you have glucose surrounding in your body. You cannot break down the the glucose because excess glucose in your body will make you go to a coma. So if you don't have them, what will happen? Your glucose will continue going on up. I'm referring to that question. I want this person to understand, so that we do what we know if there is a drug. And type 2 diabetes. What is type 2 diabetes? Type 2 diabetes is the one that you acquire after you are a grown up. You see, there are so many things which can make you have diabetes. Too much alcohol, yes. Overweight, yes. You see, exposure to some chemicals that may make the insulin production cells to be destroyed. You see that? This one is type 2 diabetes, insulin resistance. Type 2, you have lived well, you were born well with good body which is producing enough insulin, but because of lifestyle, you are eating too much carbohydrates, becoming so big. You have insulin resistance. Why insulin resistance? Is this way. You are producing little insulin that cannot convert the carbohydrates that you have. So what do? We give you something to use. Now, synthetic insulin to use or drugs to use to lower your sugar levels. So we will talk about the diabetes in details. I'm just referring to this question from someone who is asking, and I will answer it no. It is very hard to treat diabetes and live without drugs. Maybe if the diabetes is coming because of secondary infection to something. You remember when COVID was there, many people became insulin resistant. So you have to treat the disease so that we live without diabetes. But when you are born with it, you have to supplement the insulin. Your cells, the beta cells, are not producing more insulin. So we have to give you an insulin jab to be taking every day, or something if they are getting out low insulin level, we have to give you a drug that can boost. You get it? So I'll say no. When we'll come to diabetes topic, please, I will post it so that you follow up about it. Yes, yes, yes. And the other thing is type 2 diabetes. Yes, that one you can come out of it. We will see how you can come out of it. Now we are continuing. We are continuing very well. I see Asha Gail is in the house. Welcome, Asha Gail. We are just going through random questions that can make medical questions that people suffer from. Yes, let me go to my handle again. I see another question. Another question. All these questions have been prepared. There will be a topic that we run, and we started by mental health because it's something that is disturbing our youth and our generation right now because of life. But they are prepared, and we are doing good and very. We are creating a studio where we will see them. Now, let me see this. Someone has a question about stroke. My dad got a stroke. Yes, I will read that one. My dad got a stroke, and neighbors are telling me that I can get a stroke because it is genetic related. Stroke. Questions about stroke. What is stroke? What is stroke? Stroke. It's a very important question when it comes to some ages. Yes. Now, as a doctor, what I may say stroke is a medical emergency that occurs when blood flows to a part of the brain is interrupted or reduced, causing brain cell to die due to lack of oxygen and nutrients. Yes, due to lack of oxygen and nutrients. You remember our topic about brain issues? Brain issues, let me find out if my secretary brain issues. Now we have them in the videos. I don't know where those pictures are, but I find them. Stroke. Now, when there is reduced air perfusion in your brain, you can get a stroke. You see, when there is reduced air perfusion in your brain, you will get a stroke. Why? The brain cells need what? The brain cells need oxygen, oxygen perfusion. You get it? So when there is reduced oxygen in your brain, you will get stroke. Mhm. Sometimes the question you are asking is not related because genetic predisposition when it comes to stroke is uh, around 15%. Unless you have a genetic problem related to your brain that is bringing problems, it cannot relate. Now, what can make low air perfusion to go down to your brain? What can make low air perfusion to go back to your brain? We have just talked about asthma. We will now talk about another thing called ischemic attack. Ischemic attack. How can you get ischemic attack? when you have a lot of cholesterol in your system. Dorothy, yes, when you have a lot of cholesterol in your body, this one I'm still using it. Oh, this one, take this one. Sorry, guys. Sorry, guys. Yes. When you have low oxygen perfusion, what can bring it? You can have a thrombi in your system. A thrombi, we mean something that has blocked blood flow in your in your in your veins or in your arteries. When they block, you will get less amount of oxygen perfusion in the in the brain. You get it? So because your brain uses a lot of energy, what will happen? It will shut down. And when it shuts down, what happens next? The cells starts to die. When they start to die, what forms? An infarct, something that has died. So you get a stroke because the brain innervates the whole system. The brain has 12 cranial nerves. Cranial means the head. So if the brain has cranial nerves, we have 12 cranial nerves that help your body in movement, eyesight, talking, lip movement, everything, muscles of the cheeks, everything. They are ophthalmic, optic, oculomotor. Those are nerves. You can read about them, but we'll see them. Oculomotor, vagus nerve. Vagus nerve is a random nerve that it does very many things. We have hypoglossal for the tongue. You get it, optic for the eye. So they come from the brain. When an infarct, because something, when let's say an infarct has gone to an area like the frontal cortex where moods and some things like cognitive behaviors are perceived, what will happen? That place will die, and now you will not have cognitive function. You will not know how to relate with the environment. If the infarct is where it innervates the eyes, now that is a problem. You will not see because you will not have sense of seeing. You get it? It's very important. It's very important to do that. Hmm? Now let's see what will happen when yes, now I'm just answering random questions, very random questions. So genetic, we have said it has so minimal chances when it comes to it. Now we are just talking and having some relation and talking about some cases that you can have and they have problems. So what do we say about let me see if we have another question. Even stroke we will cover each time it's coming. We will cover about stroke. We'll cover about stroke. Now let's go to another question. The last question. The last question, because I can see time is going. The last question that we have today is about, let me see this. Last question is about, last question that we are having is about, let's take the question of arthritis. It's asking, can arthritis have a treatment? Can arthritis have a treatment? Yes, this is a very broad topic when it comes to arthritis. Arthritis treatment is dependent on which type of arthritis you are having. Someone asked me about genetics and relations. Arthritis can be genetic. It can be genetic. In this way, you can pass the rheumatic factor, that is rheumatoid arthritis, to your generation. You get it? You can pass the rheumatic factor to your generation. In which sense? In this sense, the factor that you are having is producing more uric acid, and that factor is called, let me say, how many types of arthritis do we have? We have osteoarthritis, we have rheumatoid arthritis, we have gout arthritis. Yes, we have systemic lupus erythematosus. Most of these conditions are autoimmune. When I'm saying about autoimmune, it means the cells of your body are fighting against your cells. So if you have a rheumatoid factor in your family that is being transferred to the other factors, it means you can inherit the condition. You can inherit the condition. So let's go on. We will talk about it next time. Thank you for everyone that has come to the platform. You have so many questions, but I have to get to work. I was just picking random questions. We will have a random time for questions tomorrow. We see what can happen. Thank you very much for coming to the platform. If you have a random question, just post it below the handle and everything will be okay. I for ladies, the topic on menses, I've gone deep. You will go to the back to the other videos you learn as we go on. Thank you so much, everyone in the platform. Welcome again for your support. Remember to subscribe as we grow together. Remember to subscribe. Yes, my friends, you are my friends. Everyone in the platform is my friend, and as I say, love is my religion. I love everyone. Good day, and remember to support our general himself and Jamaican uncle. Everyone who has a channel, remember to support. Big up, and let's meet to the next stream.